Furamist nasal spray consists of fluticasone furoate, which is a synthetic trifluorinated corticosteroid with potent anti-inflammatory activity. This nasal spray is mainly used in the treatment of sneezing and runny nose due to allergies. It provides relief from symptoms of allergic rhinitis so that you can carry out your daily activities. It rarely has any serious side effects and may make you feel less sleepy compared to other antihistamine medicines. Use this medicine in the dose and duration as advised by your doctor. Read the instructions on the label before use. The first step is to clean your nose. In case if you are using the nasal spray for the first time, test fire the spray. Here you can see the protective cap, the spray nozzle, and the shoulders on either side. Remove the protective cap and gently shake the bottle. Insert the tip of the nozzle by slightly tilting the head forward. First close one nostril and squeeze the spray into the other. Remove the tip from the nostril and repeat the same for the other. As you spray, breathe gently and keep the head upright.